Well, we're here for another episode of An Ounce of Prevention with Candace and Kara. And this time we're going to talk about what the health department does, what you guys actually do. So thanks for coming in and talking a little bit today.
Yeah, super excited to tell everyone about all of the different things that we do.
Well, it's mostly vaccines and food, right?
Oh, Jason, I'm so glad we're here today because we're going to give you a little more than just vaccines and food inspection. So,
which, for the record, you haven't done for a number of years, correct?
Correct.
Yeah, those were taken away from the health departments and given to the ag department over time.
Yes.
Yeah, about 20 years ago, I believe.
Probably,
long time.
Yeah, forever.
A hot minute.
So if you're upset or you think a restaurant needs inspected, don't call your local health department. They don't do that anymore.
No, they will not be able to help you
Can't do a
at
thing.
all.
That's right. Tell us a little bit. I mean, I know, and I serve on an advisory committee for the health department, so I'm a little bit familiar. But for people who aren't, let's talk about, you have a number of different divisions that are responsible for different functions in the community. So can we run through some of those and talk about what happens and what the work is in those divisions?
Yeah, that's probably the easiest way to go through.
I'll start with the shots because obviously that is what people, if they know anything about Reno County Health Department, they know that they've probably had a vaccine or two there. Mm-hmm. Whether it's on-site, we do on-site vaccinations, and then we have off-site, which would be like flu and now COVID clinics at schools and offices and things like that.
Okay.
So that's one thing we're known for. We do a variety of vaccines. So we do all of your childhood immunizations. So that's 2 months to 12 months. We have what's called the Vaccines for Children program, which essentially means if someone is uninsured or underinsured, children under 18 get those vaccines for free.
Okay.
There is a $20 administration fee per vaccine or per shot. But we also have a sliding fee scale, which allows us to use income to slide that fee anywhere from 0% off to 100% covered.
Okay.
So we have lots of options for making sure that children get the essential vaccines.
So definitely if income is a barrier to vaccinate, it doesn't need to be. Because
doesn't
you guys
need
can
to be,
take
for
care
sure.
of that. Yeah.
Yeah, so we do a lot of the childhood vaccines. We also have travel vaccines. So if you're going overseas, you need a yellow fever shot or a typhoid shot. Those are pretty common. You call our health department, our nurse coordinates that. They coordinate with your insurance, and then you get your travel vaccines as well. And then the essential flu, COVID, those kind of things.
And that all falls kind of under the clinical part of things,
yes.
Right? Okay. And then so when you go to schools, that's to try to, like, for people that have trouble getting to a doctor or to the health department. So you try to meet people where they are.
Yeah, exactly. Yeah, it makes it so much more convenient. Sometimes taking a kid out of school for an appointment, we know that's not best practice. So bringing the clinic to them to allow them to get their vaccines at school takes a couple seconds and they can go right back to class.
I mean, sometimes they think you forget that, like, taking a kid out of school is part of it. Parent has to take off of work. Mm-hmm. It's a whole thing. There's income lost in that situation. Mm-hmm. Or potentially, or the use of PTO time. But a lot of jobs don't have PTO time. So people are just taking unpaid time off to go get a vaccine. So that feels like a big service to a lot of people in the community.
It really is. And then you're not also exposing kids to flu and COVID where people are going to get sick. So they're where they're comfortable and their immunities are built. So there's a lot of benefits to that.
So, but as we stated, it's not the only thing you do. So
Correct.
There's a lot of other things that you do. So let's run through some of those.
Yeah. That would be exciting. I would love to tell you all about, actually, I'm going to start with older adult health services because a lot of people don't know that we do this. And
I didn't know that we did this.
Right? It's super needed in the community too. So older adult services is a group, right now it's all ladies, that happens to be. So they go out into homes and do just kind of basic daily living things for people. So they can do some light housekeeping. They can make sure that meds are put into like a thing so people take them correctly Monday, Tuesday, Wednesday,
like
Thursday.
I have to do, so I remember.
Exactly. So they do that, which is great. They also can do some personal hygiene things like helping people with showers, washing feet, those kinds of things. Some super simple like meal preparation for people as well, which is always helpful. They can run to, grocery store and get things. They also do a lot of foot care clinics, which is, again, really needed. So they actually go out into the community. They go Turon, Buhler, Haven, anywhere in Reno County. Especially if there's a senior center, they are probably there once a month doing a foot care clinic. So as we age, it's harder to reach our feet. And we know that feet are super important. And especially if you have any kind of like diabetes or any other kind of issues happening, your feet are kind of the first thing that go. And so taking care of your feet is really important. And so they go and they wash and clean the toes up and, clip your nails, do all of those kinds of things, like a little mini pedicure without the polish. And so they do all of that work for people to really make sure that their feet are taken care of. And like I said, they go out into the community, all the way out into the county, and it's once a month. They're pretty much everywhere in the county.
Yeah, we also have foot care clinics in clinic. We do those Tuesday mornings from 8:30 to noon, and anyone can come in and get their feet done. We have our older adults. If you're diabetic, we have a nurse that specializes in diabetic foot care, and so she does that. So those Tuesday mornings, people can book to come in if they're able to do that. It's a $20 fee. They can pay cash or card, and they get their feet done. And those are popular. We're usually booked out for those for quite a way. So definitely a service that's needed in our community and something I don't know that people offer.
Yeah, I was so surprised when I learned about this. The foot care, when you go out into the community or you go into homes for the light, daily living stuff, is there a charge for that?
There is a slight charge.
So if they're doing foot care off-site in a home, it's a $25 fee. The homemaking part, the older adult care stuff, that all falls within their Medicare and those kind of things.
Okay.
So we have the nurse who is in charge of that coordinates all of those kind of services within her staff, and they work that out through their Medicare.
Okay. So if you're on Medicare and you're in need of those services, then it is covered.
Yes.
It's a covered good.
Yeah, and they just need to call and set up an appointment with us. So just call the health department and they'll get taken to the right place.
Just call and say, I'm interested in the older. What is it? Tell me what it's called exactly.
Older adult services.
Older adult services. Okay.
Yeah, and if there's any questions, whether it's about older adult services, whether it's about some of the other things that we're going to talk about a little later, we do have a billing specialist that's there. And it's not my area of expertise, but she definitely goes over what's covered, what's not, how we can best fit that so that the person's responsibility is as low as it possibly can be. And so they would just call the health department, we patch them through to her, and then she'll go over what each insurance or each medical card covers and what it doesn't, so that you're aware right up front.
Okay. That's such a good service. I'm so glad to, I hope that people really will get this out and people really learn about it, because it's just, as you said, it's so needed in the community, and I think people don't know about it.
Yeah. And if they don't know what they don't know, and being able to have this service available is just amazing. And hopefully we can get more and more people involved.
Good. So what other things kind of fall under the health department here? I know you guys deal in so many things, and we may not even be able to talk about all of them, but
Candace should talk about the coolest one, the health education department, because we are one of the few health departments in the state that has a robust health education department.
Yeah, so that is my specialty. I am the health education and promotion supervisor, is my official title, which always sounds really weird to me. But anyway, so we really are all about going out into the community and engaging in education on a variety of topics. So we used to say we're all about drugs, alcohol, and sex, the fun things, but telling people not to do them.
Yeah. So you take the fun things and then you're a fun sucker. You're just like, yeah, these are fun things. Don't do them.
Don't do them. So that's not totally true. But we are really about education and making sure that people understand why they want to do the things or how to stop themselves from doing the things. The health education department has a variety of topics that we go over, and we are actually funded by multiple grants that we have. So currently we have a Bureau of Justice Assistance grant, BJA, it's called COSUP, the Community overdose. Nope. Sorry.
Comprehensive overdose and stimulant. Oh, comprehensive opioid and stimulant substance use
Prevention. Program. Yeah, it's a hard one. That's why it's called BJA COSUP.
Yeah.
I was like, we're going to get there between the two of
alphabet
us.
soup, right?
Yes,
of,
exactly.
Of the world, grant world and government world,
Yes.
right?
Yeah. And we really like our acronyms in health ed. You'll feel that as I start to talk even more. I'll try really hard not to talk in acronyms, so feel free to call me out when I do.
I'll be like, what's that stand for?
Yeah. So COSUP we're doing two things with that. One is that we have an overdose fatality review board. We are actually the first and only that I am aware of in Kansas. And we are working on a few others that are doing it. So what we do is we take an overdose death and we have a group of people that talks about where there's a missed intervention. So it's not about laying blame. Mm-hmm. It's about where can we have done this intervention that would have moved this person into a state of recovery, or that they could have lived.
It's trying to improve. It's trying to use the data from an unfortunate situation to better inform the system.
Correct.
Right? Yeah.
Yes. Yeah. So we have like I said, a wide variety of people. We have the police, we have sheriff, we have the district attorney's office, but we also have Horizons and the hospital and SAC, the Substance Abuse Center of Kansas.
Educators, EMTs, all kinds of people that may come in contact with a person.
Yeah.
So really working on the whole system and where we can provide those interventions to help people to move on to the road of recovery.
Does that board produce any kind of reports or anything that says, hey, this is the recommended changes that we should make in our systems or anything like that?
Yeah. So we actually, we are kind of starting our second year of the OFR. We also have actually an oversight committee that is the people that can make the changes. So the district attorney, the sheriff, specifically Horizons CEO, the hospital CEO, the people that can make the actual changes. And we bring to them a list of recommendations and talk through how we would like to see those recommendations happen and what they can do to help with this process. And then, as we move forward, we're hoping to continue to show people how the OFR has created these recommendations, and then that has changed the system and how that all works together.
In this, I know I'm familiar. I was less familiar with that, but familiar with the overdose dashboard, right? That the health department has, which has been there for a number of years. But that's been really helpful in better understanding what's causing overdoses in our community and some of the root causes and some of our reactions to it, right?
Yes. Yeah. So 2020, we actually started, in 2019, we had a opioid report that we put out that said that, opioids are an issue. How are we going to make this not an issue in our community? And so at that point, we also had the Drug Impact Task Force, which is now the Reno Recovery Collaborative, because we've kind of moved and changed and learned along the way. And they said, we need a person that is specifically geared towards the opioid crisis and how we can help with this crisis that's happening, that we know is happening in our community. And so at that point, we hired Seth Dewey, and he was kind of our opioid guy. He was our drug guy at that time, who started the OD map, the dashboard that you spoke of, which is really an interesting map. If you go and look at it, it's on the Reno Recovery Collaborative website. You can find the OD map on there, and it's got all sorts of information. It has all of the information from 2020. So it started in October of 2020 is when we started really digging down into that information. And so it has like deaths, it has overdoses, it has what the substance is, if we know, and it shows in graph form, scattered plot lines and all of the things. It really talks about all of the different ways that people are using drugs and how they're overdosing and where we can intervene and make some progress on those things. So that's one of the data points that we really lean into.
It also allows us to see what is trending so that health education can then gear their education efforts more towards whatever substance is the substance of choice.
Yeah.
And so, if we're seeing a spike in alcohol, we know that health education needs to get out to places and talk about the risks of overusing alcohol and so on and so forth.
Yeah, so OD MAP is actually a nationwide thing that EMS has agreed to put their data into it. And actually now the Kansas State Board, because of all of the work that we've done, the Kansas State Board of EMS is actually the one that puts in all of the data for all of Kansas. So you can see on OD MAP where all of these overdoses are happening. And you can see it all over the United States, as long as they are part of that. So we can actually... we have back-end access that not everyone has, right?
Sure.
So that we can kind of watch all of the things, all of the trends happen. But we can watch the drugs come from Oklahoma or from Missouri and fly through Wichita and then hit us. So we can kind of know, what's coming.
Yeah.
So we can gear our educations towards that. That's also, we periodically put out spike alerts, and those come from OD MAP. So if we have had in 24 hours 3 deaths of the same substance or 3 overdoses of the same substance, we put out a spike alert and say, hey, we know this substance there's something going on with this substance. We need to alert you. So be aware, especially if you're going to be using this illegal substance. How do you protect yourself? Make sure that you have naloxone on you, all of the things, and just be aware. Just know that something is going on right now. And so that people can change their behaviors is the plan.
Am I right in thinking there was a spike alert issued not too long ago?
Well, so we put out an alert when we had the kratom became a Schedule 1.
That's right. So it became unavailable and people
correct.
had been using that.
Yeah.
Right, yes.
And people had been using that for a variety of reasons. Part of that is also as an opioid withdrawal drug. And so so we put out information about where they could go to actually get medically assisted treatment, and what that all meant and how to kind of adjust your...
And you do that so people aren't just on their own trying to manage this problem.
Correct.
if they were using kratom to move off of opiates, right?
Yes. Okay. Yeah. And it's how the brain chemistry works and how all of that functions together, and how if you can't have this one thing, okay, so let's work through therapy, let's work through some medically assisted treatment that you can get legally and can come to you, and how we can help people through that process.
That's really nice. So I could talk about this all day, but I want to make sure we talk about this because it's fascinating. It's an issue I care about a lot.
Yeah.
But I know there's a lot of other things we want to talk about. Maybe we'll come in and do a whole episode on this sometime.
I was going to say, we can do that, and we'll bring the drug guy, Thomas, as well.
Oh, yeah. No, that'd be great. Yeah.
And he also can talk on it for hours and days. So, yes, he's great. So the other part of the COSUB grant is actually we started medically assisted treatment in the correctional facility here in town. Not a lot of people know that, but our correctional facility is actually, I believe, the only one in Kansas still that does medically assisted treatment for people with opioid use disorder in the correctional facility. So especially if someone is already on, so it's called MAT, medically assisted treatment, also known as MOOD, medications for opioid use disorder.
Okay. And can you give me a little explainer about what that is? I know it's kind of self-explanatory, but there's more to it than that, right? It's a very specific process.
It is. So you have to hit the criteria for an opioid use disorder, because currently really the only on-label, there's 2. So if you have opioid use disorder or alcohol use disorder, those are really the only 2 that we have medications that can help with the brain chemistry and all of that functioning through your body. So we have opioid use disorder. We actually are able to do Sublocade, which is a shot that they get, and it lasts for a month, which is a new thing that we've just started doing there, which is super exciting for everyone, including the jail, because they're able to then be on this medication for longer. So it's good for them. And then for alcohol use disorder, they also can get some medication to help with that.
Okay. But you guys are doing that at the correctional facility, at the county jail, basically,
correct.
right?
Yeah.
Okay.
Yeah. So at the county jail, we work with the correctional facility, and then Horizons is the one that is doing the medication prescribing there.
Okay.
So they are able to also do therapy, which is another part of getting through and being able to actually really have Matt work well, you need both the medication and the therapy. Yeah. And so they're able to do both of those things there at the correctional facility, which is great.
Why is it important that we're doing this at the correctional facility?
Yeah. So what we see is that a lot of people are in the correctional facility because they have an opioid use disorder and a mental health disorder. And so being able to provide the medication and the therapy in a safe space, because they're not necessarily going to have that safe space at home.
That's right.
And so having that safe space there at the correctional facility that they can start their process and really kind of get into a routine and understand how it feels to also have those medications in your system and how the routine works, then they're in a safe space. And then when they are released, they are able to then hopefully continue that out into the community.
And ultimately, I'm thinking about the potential reduced cost to taxpayers is the idea would be that if they get on this treatment and they are successful in that and they can continue it after they're released, they're less likely to end up back in the county jail where we house them and feed them and do all this again, right?
Yeah, yes. So what we're looking at is hopefully long-term is a lower recidivism rate for that.
Yeah. Yep. Which is a lower cost to taxpayers.
Correct. Yes. Yeah.
We sometimes forget that, like, you make an investment in one part, try to solve a problem on the front end, that it saves you money on the back end.
We talked about that, I think, in the last episode, that upstream practice of the prevention. That's going to, it may seem like this big chunk in the beginning of money, but the long-term effects and savings is what we really need to focus on. That's going to prevent so much other cost down the road.
Yeah.
Well, and then you're not only just talking about housing a person in a correctional facility, but then you're talking about them hopefully then being able to get a job, get stable housing, provide for their family, just all of the other ramifications that then takes on. And then also so you're not passing that on to your children.
Yeah, breaking the cycles.
Yeah. Yeah, there's lots of long-term benefit to some of these interventions, right?
Correct. Yeah. We have to stop looking short-term. It's really hard to not be like, I just want that instant win, because we all just want that instant win, and say, okay, I know this is going to take a while. And opioid use disorder is one of those things that is definitely, it takes a while. It's like smoking, right? Nobody just quits smoking. Not nobody. Most people
do, but
most people do not just quit smoking and then move on and it's fine. It takes a few tries.
Multiple attempts. Some people use medication, patches, gums, all the things,
right? And so it's similar. And so it might take multiple attempts, but eventually, hopefully, what we're looking for is long-term success.
Yeah. And really, when it comes to addiction, there's two possible trajectories, really. There's one that you get better and you get into active recovery and you stay there and you become productive and you work and you're paying taxes and all those. And the other is that it continues to get worse and usually ends in a death.
And then you're on our OFR board and we're trying to figure out where we could have intervened.
Yep, exactly. Yeah.
And all of these things are like just health education in general. The goal of Candace's wonderful department is to do that preventative work. So the education, whether it's about substances, education about STIs, and education about mental health. So they have just a variety of things that they do to keep you and prevent you from going down a path that may not be the best for you in the long run. And so she's talked about one of the grants. There are a couple other grants in there. The CDRR grant, which is chronic disease risk reduction, and then the Pathways to a Healthy Kansas, that's from Blue Cross Blue Shield. And both of those grants really focus on, as the chronic disease risk reduction was, decreasing that risk of poor health outcomes. And so they do a lot out in the community. They have a lot of partnerships with community members so that it's really the whole person approach to making sure that all of us here in Reno County have the opportunity to live the most healthy lives that we can.
Yeah, trying to make the healthy choice the easy choice, right? Yeah. So whether that be a grocery store on the corner and, not a gas station or a Dollar General, and a trail and an easy way to get from point A to point B that you don't have to necessarily drive, but you could ride your bike or you could walk and it's safe, right? Because that's the other caveat is that, I can walk across the street, maybe, but is there a way for me to get there safely? Is there a way to, especially if I'm younger or older, are the stoplights long enough that I can actually
make
walk
it across?
That far?
I always think about, there used to be bulb outs in the middle of the block in Hutch. Do you remember this?
No.
No, there used to be like the middle on Main Street, the middle of the block would have a crosswalk. So you could cross. There were 3 places and it slowed traffic down. We've gotten away from that, but it used to be traffic.
They need to bring it back.
Car traffic was at a crawl because there were a lot of people walking and you didn't know if they were going to cross at the end of the block or the middle of the block. But I liked it. I was a kid when I remember that, but it was nice.
Yeah.
But you work in a number of areas. The health education, we've worked on food issues before and on food availability in the community and things like that.
So part of the other 2 grants that Kara spoke about, CDRR and Pathways, is that we have to have a wellness coalition in order to apply for those and make that work move forward. So we have the Reno County Community Wellness Coalition, RCCWC, because again, like I said, we like our
Love
acronyms.
our acronyms.
Or you could call it RCWIC if you really want.
This is true. And so under that, we have the Food Advisory Council, which you're a part of, which is great. And then we also have the Reno County School Health and Wellness Alliance, Rickshaw. We have the Healthcare Access Task Force. The Bike Walk Hutch kind of fits underneath there as well. And the Reno Recovery Collaborative and
the Mental Health Task Force.
Thank you. I always forget one. So
yeah. And so all of those groups are focused on one part of the wellness, but then there's overlapping again, so that we know it's not like you can't just prevent something in isolation, right? If you solve this problem, it just doesn't go away. So really that coalition houses all of those different groups so that we can really, again, make sure that we have a healthy and thriving population in Reno County.
And that allows you to see the kind of the intersection of those things, like if the walkability of a community, can you walk? But also if you can walk, but the food is bad in your area, then we have to address that. It's It's a big picture thing. And I think that's another thing that I appreciate about what you guys are doing is that it is a big picture and it's a long range picture.
Yeah, we're about the community health versus personal health, right? So we try to really focus on the big picture, what we can do as a community versus what we're doing individually, and how we can change that system as a community versus how I can change my system as just an individual person. So,
do you think if you weren't doing this at the health department, do you think this work would be getting done?
That's kind of a tricky question because we do have a lot. Hutch has got a ton of groups, and that's a great benefit. What I think the health department does with this wellness coalition is really brings all the groups together. So they're not operating in silos. It allows that work to, if we have a bunch of people working on one thing, that's a lot better than this one group with a few people and this one group. There's everyone's coming together under the same goal. So I think that there's a lot of good people with a lot of good hearts in Reno County. I think what this allows is that cohesiveness of all of those groups to work together.
And kind of channel it in a concerted effort, right? Yeah. What other areas do you look at? So the health education's got the opioid or the substance misuse, food, all the acronyms that you went through. I'll never remember them all, but but all of that. Are there other areas?
Well, that's a little bit about the health education. Within the health department, we have a lot of still more programs to, again, start with healthy outcomes. And so a couple of those, one is the maternal child health program.
Okay.
A lot of people aren't aware that we do have this whole other aspect of our health department that's just more than just shots, more than just education, because I think we're doing a good job of getting the word out now that we're educating. But this program is really great. It is like a team effort. It's made up. We have a couple of registered nurses. We have an APRN who kind of oversees it, a social worker. They work under a licensed physician, and then we also have a translator so that there aren't barriers in this care. And what they do in the maternal child health program is connect expectant mothers with community resources and pediatric services so that once their baby, even prior to their baby being born, they're getting health looked at. They're making sure that their pregnancy is healthy. And then beyond that, they're making sure that that mom and that baby are connected into the community. They provide medical, nutritional, parenting education. Our maternal child health nurse does home visits during pregnancy. They check the mama, they make sure everything's healthy, help her get set up with pediatricians in the community so that her baby can have care afterwards. And then once the baby is born, up to a year, that maternal child health nurse does weight checks and really oversees that baby to make sure that first year of life is the healthiest possible. She also will just do an assessment to make sure, mom is mentally healthy so that, if she's experiencing any postpartum symptoms, she can make sure that she gets her the resources that she needs, which is really great. She checks for milestones, making sure those babies are meeting that. And if they're not, what do we need to look at? And then our social worker works with our mamas on getting them either Medicaid or working with their insurance to make sure that they're set up for that healthy future. And then
things that might be very overwhelming
Exactly.
to a new mother or an expectant mother.
Exactly. Yeah. And it's just it's a really great team who really care about those mamas and those babies. So that's a program that we offer. That program, we accept most insurances. We also accept Medicaid, and a lot of those services are applicable to our sliding fee scale up to 50%.
Do you get pretty good response to that? Is that
Yes.
widely used in the community?
Yes.
I would think so. That's such a benefit
is.
to new families.
It is. And again, I don't think a lot of people know, but yeah, it is a great program. And the people that are working in that really have a heart for it. So they're amazing people.
That's outstanding.
The other part of that I wanted to touch on is that we also do STI testing as well as birth control. So if someone needs help with covering the cost of any of those things, we do that at the health department as well. So
you also track those, right? I
Correct.
know there's some alerts
Yes.
that come out whenever
yes.
there's something happening in that realm. I know about it.
So we have an epidemiologist as well on staff, and she tracks. So not only STIs, we have continued to have a congenital syphilis outbreak. That's kind of been a thing going on for a while.
Babies born with syphilis?
Yeah, correct. Okay. So making sure that everyone's getting tested. So most, if not all, moms get tested while they're pregnant. It's just to make sure that things aren't getting passed along to baby.
Yeah.
So she tracks all of those kinds of things, and then she also tracks like dog bites, TB, any of like the outbreaks that we've had going on with the cyclospore.
I was going to ask about.
I was going to say the
you guys
diarrhea
involved in
lettuce.
it? Yeah.
Yeah, so our epidemiologist.
What kind of timeline are we on where lettuce is the most dangerous thing you can eat, right?
It's wild. Yeah, pretty much everything that I enjoy eating is on the chopping block right now for it. But no, our epidemiologist really tracks any disease that you could possibly care about, any infection. She tracks, kind of like with our OD map, she tracks areas in which there's an outbreak, whether it be measles, whether it be cyclospora, watches those trends and then says, hey, we're starting to see this in Reno County. And then that's when we would put out a press release or an alert of, hey, we're seeing, 13 cases of cyclospora in Reno County, and make sure you're doing this. And then the education piece comes in.
Did we have that many?
We
here?
did.
We did?
Yeah.
Yeah. I mean,
Yeah.
how do you avoid it?
Everybody eats a Taco Bell.
Oh, I know, right?
Listen, I have not given up Taco Bell.
Just say hold the
Shout
lettuce,
out
right?
Taco Bell. Yeah. So we have a lot of programs like that. Back to like maternal child health, we do the Bump to Baby program, which is really great. They go through a series of 6 sessions, and so you don't have to be part of our maternal child health program for that. But
I feel like this used to be called Lamaze class.
Oh,
it's
okay,
now
yeah.
called Bump to Baby.
Okay.
Yes. And it goes over like, infant feeding, breastfeeding type of things, healthy pregnancies, healthy nutrition, labor, delivery, how you do all of that. And then they get infant care, so that's safe sleep to decrease the risk of SIDS. And then there's a postpartum and recovery session as well. So they also get to interact with other pregnant women. I know that when I was in a similar class like this, I met one of my really good friends in that class.
Okay.
So it was another mama that had kids at the same time. So we do that. Our maternal child health nurses teach that, and also our WIC director does a class or two of that as well, which leads me to our WIC department.
Oh, yeah.
Our health department has a WIC program. And if you're not familiar, WIC stands for Women, Infant, and Children, and it is an amazing program. I know my husband and I, when we had our first 2 kids, we were struggling to meet ends meet, and the WIC program provided us with essentials that kept me and our kiddos healthy. It's amazing. And so
Our family used it too when our kids were little. It was great.
It is a saving grace for so many people. Not only do you get the essential food kind of packages, that's what people think if they think of that, but it also gives parents education on how to eat healthy, how to introduce your kids to healthy foods. We have 3 registered dietitians who do a phenomenal job of that education. And because Reno County Health Department kind of works together, one of those dietitians sits on our food advisory council. And so it's just this really, again, you're hearing a theme of cohesive piece to make sure that overall wellness is addressed.
I do want to add for WIC that if it is a single father that is taking care of his kids, he also can actually apply for WIC. He won't get the supplemental breastfeeding food, but he will get the rest of
to take care of his family,
yes,
right?
Correct.
Yeah, we have a few single fathers that have come in and they are on WIC, which is a new amazing addition.
Oh, that's very good. And that you have somebody specifically to handle those applications and help manage that program as well, right?
Correct.
Yeah.
Yeah, we have our clerk that does that, and then the 3 dietitians see the clients. And so they can come in, ask questions, or call, and then they will come in and see them. There's certain requirements that WIC goes through with how many times they have education courses and all of that, but then they get their food bundles and things like that.
Yeah, that's a great program. It's, I remember it was a lifesaver for us, so. Yeah. Okay, there's another, it's talking about children. You also do childcare licensing. Is that correct?
Correct. Okay. So the childcare licensing people are housed within the health department. It's actually, they're KDHE. They also work through KDHE.
Okay.
So they just make sure that safe quality care for kids is available in Reno County as well as Harvey County. So they actually do 2 counties.
KDHE stands for Kansas Department of Health and Environment.
Thank you.
Yes. Sorry. See,
that's one I know, so I wasn't going to call it out.
I was like, in case anyone's not in that world.
Yeah. So they just make sure that people are following the regulations. They go in and they help in-home childcare as well as the center-based programs. They offer some training classes. If you're interested in becoming a certified childcare licensed facility, they provide all of the beginning steps for that and some trainings there. They also do fingerprinting. So if someone is in need of some fingerprinting services, whether that be for childcare or like teachers or subs or whatever the need may be, they can also do fingerprinting there as well. So it's just
because it used to be kind of a hassle. I think you had to go to Topeka or something to do the fingerprinting a while back, but yeah.
Yeah. So if you're an educator or you're in childcare, you can call the health department. We will put you through to the childcare licensing department, and they will set up an appointment for that, and it is free.
Okay.
Which is another benefit. They do orientations for people who might be considering an in-home child care or a child care facility, and they go through the ins and outs of that. And then health education comes in and provides education about having a completely tobacco-free campus for your child care facility. They also, talk a little bit about resources that might be available if the families want to talk to parents. And so, again, comprehensive approach to wellness.
And contrary to, I think there's sometimes a misconception that the regulations around childcare are designed to punish providers or make it impossible. And there is a childcare shortage that has been for ages. But the goal really is I've talked with you guys before about the goal is to really make it successful and to navigate a path of success for providers.
Yeah. Yeah. And they're not there to, I mean, yes, there are regulations that have to be followed, right? And that's for the safety of our children. Like I would prefer that some regulations be in place so my kid was in a safe space, right? I personally.
Yeah. People forget about regulations, and I would always tell people this. If there's a regulation around childcare, it's because it's most likely because a child was harmed, and this was in response to that. Yeah. So these things generally aren't just out of thin air. They're enacted because there's a data point that said a kid got hurt, and we need to make sure this doesn't happen.
Exactly.
Yeah.
And our licensing specialists, really, they do handle complaints. So if someone has a child in daycare and they see something wrong, they can do a complaint. And our child care licensing specialists go out and really track that and investigate. But aside from that, the specialists that we have really want to partner and work alongside child care facilities so that all complaints can be avoided, or, they're just really working as a partner with them versus an overseer of them. And right. So I think that's really special. And something important to note is they're there to help you be successful. They want you to be there. They want you to be providing that safe environment for the children. They want people to, want to send their kids there. So they really have worked to be partners with those facilities.
That's good. Well, I know there are some other areas we haven't touched on, but we've covered a lot. But there's a few other areas that you guys kind of have your hands in.
Yeah. So the other one that kind of comes to mind is public health emergency preparedness. Okay. So we do, in cases of an emergency, I mean, obviously the big one was COVID, right? That was that's an easy one to point to. But we also do the same sort of thing for other things that have happened. So actually, during the time of COVID, we actually also had a Hep A outbreak. And we sent a team out. KDHA was also involved with that. They brought their mobile unit. We went out to where in the streets this was actually happening, the Hep A outbreak, and we're able to take out information, do testing, as well as provide other services and opportunities for people to help them with the outbreak and make sure that they were getting the care that they needed.
Yeah. Yeah, you guys have, I remember the Sonic ordeal from years ago.
Yeah. So all of those types of things, the tornado, right? Like we were, the Sylvia tornado, we were out there as well, handing out information and doing different things through that as well.
Okay. So you involved in anything that's emergency related. Correct. And the health parts of that, right?
Yeah. Like if there is a tornado or some sort of emergency like that, one thing you're concerned about as cleanup begins is tetanus. So are we up to date on our tetanus shot? Do you need a tetanus shot? Which kind of leads to the fact that at Reno County Health Department, and really any health department in the state, but we have access to what's called Kansas Web IZ, and that is the immunization registry. So if your immunizations have been inputted, whether you got them at the health department or whether you got them at Prairie Star or the clinic, we can pull up your immunizations that we have on file and give you copies of those. So you would know my last tetanus shot was 10 years ago. It's about time for another one. Yeah. It also provides you, when we print out those reports, which we do free of charge. People come bring their ID and they can get their records and their children's immunization records. So if you've lost them like I had, you can get those copies. Yeah. On the side, it tells you exactly when your next one might be due. So that's a helpful service. We get a lot of those at back to school time, but some people don't realize that they just pop into the health department and we'll print them out their copies of their immunization.
That's a great service. You know what gets me about tetanus? And I think this could to what we forgot, or what we talked about last time, where we sometimes forget the success of public health. Yeah. People used to die from rusty razor blades.
Correct.
Right? They'd shave. Henry David Thoreau's brother died from a rusty razor, and he got lockjaw from tetanus, which no one dies from now.
No, because we have vaccinations.
It's amazing.
Right?
Yeah. When we learn, we do better, right?
That's right.
So I think we did a pretty good job covering the health department as a whole, but I kind of want to go over hours and things that you can do if that's okay with everybody.
Absolutely.
Because I think that's important to note.
Did you also want to talk about FAB accreditation?
Yeah. Yeah. Okay. So we are.
You have to tell me what FAB stands for.
Yes. Well, it's fabulous. You should know it. FAB is actually spelled PHAB, and it stands for Public Health Accreditation Board.
Okay.
It is a voluntary accreditation board. It is a 5-year period. If a health department wants to do this, they have a very stringent process and a lot of data that they collect to show that their health department is doing all of the services that they're saying they're doing. And so Reno County is one of the few in Kansas that is FAB accredited. So we're getting ready to go into the next cycle. We had just finished up our last year of that, and now we're going through the accreditation process again. But I just like to point that out because that shows you that the work that's being done at Reno County is good work.
Yeah.
And not that any health department that doesn't go through it, we have a lot of smaller health departments in the state, but it also shows you our commitment to making sure that we're the best.
And it's an accreditation that's not required.
Correct.
You guys
it's voluntary.
Voluntary.
Yes,
okay.
voluntary, and it's not like we sign this paper and you're good. It is a voluntary.
It's not like a pay-to-play thing. You
Correct.
have to prove.
It's,
right, yes.
It's some stringent requirements, a lot of data, and it involves all of the programs within our health department to prove the work that we're doing is fabulous.
See what
nice. I did there?
Yeah, I like that.
Yes. Well, our fabulous health department is open Monday through Friday. Our Monday, Tuesday, and Thursday hours are from 7:30 a.m. to 6 p.m.
Okay.
Our Wednesday hours are from 9 a.m. to 6 p.m. And on Fridays, we're open from 8 until noon. The WIC office is closed on Fridays.
Okay.
So if you're looking for WIC services, come in one of the other days, or you can call and leave a message. So we prefer appointments. That just makes it a little easier, especially during our busier seasons, which are back to school and during cold and flu seasons.
Okay. Which is typically what? October, November?
Yeah, we'll start probably ramping up our flu at the end of September, beginning of October. Back to school usually starts, it started earlier this year, but the end of July all the way through middle of August, kids getting their back to school vaccines, schools notifying them that they need them. And so we can take walk-ins, but we do an appointment, just make sure that we have a space for you. Some of our providers that do the family planning or the women's health type of things, they're only in office, Monday through Wednesday. So make sure if you are wanting one of our services, you give us a call and we can get that appointment scheduled.
One of the other things we didn't mention is we do TB testing as well.
Oh, okay.
And so,
some jobs require that,
correct.
right?
And there are only certain days that you can come in and do that, and that's Monday, Tuesday, and Wednesday.
So with our TB skin test, we prefer to do those Mondays and Tuesdays because there is a 48-hour read time. So that means you would need to come in. If you come in on Monday, you come back in on Wednesday. If you come in on Tuesday, you come back in on Thursday. And Friday, we're only open until noon. So if you get it done on Wednesday, you have to make sure that you get it done in the morning. And then, because otherwise you're going to have to retest. And that's not ever very fun. Those are billable to insurance. They are also billable to Medicaid. If you're self-pay, it's only $26. So you bring in $26 at the time of service and we'll get you that TB skin test. So if someone needs one of those, I know I've probably had two in Reno County for jobs. And so that's a great point. We do a lot of those at back to school time.
That's great. Well, it's just really impressive to me, all the areas that you all touch on. And I think I made the joke at the beginning about you do vaccinations and foods, but that was kind of the point that I think there's a long-standing idea that, this is what the health department does, but it's just so much more. And the idea of public health has evolved so much over time.
Yeah, I did a presentation once and I apparently said this multiple times, but I think it should be a bumper sticker. Reno County Health Department, we're more than just vaccines.
I like that. Well, I appreciate you both coming in and visiting today and telling us all about the wild number of things that you all do at the Reno County Health Department. and glad that we can let people know about this and make a phone call.
Yeah, we'll drop in too. We'll talk to you.
Yeah. Thank you all.
Thank you. Thank you to Blue Cross and Blue Shield Pathways to a Healthy Kansas grant.
Our theme music is Never Going Home by Charlie Lewis, provided by the Free Music Archive under a Creative Commons Attribution Non-Commercial Share-alike license. A Salt City Sound production.